This is an audio-visual representation of a study published in the Journal of Bone and Joint Surgery in 2022. The medial meniscus is integral to knee joint function. A medial meniscus that extrudes beyond the margins of the tibial plateau is associated with the progression of osteoarthritis. Medial opening-wedge high tibial osteotomy is an effective method for treating medial compartment knee osteoarthritis. However, the extent to which medial meniscal extrusion affects the intermediate-term outcomes of high tibial osteotomy is unclear. To determine this relationship, researchers from the Republic of Korea reviewed the records of 212 patients who had undergone medial opening-wedge high tibial osteotomy. They then characterized these patients into two groups based on the presence of pathological medial meniscal extrusion, defined as extrusion of greater than 3 millimeters, as determined with preoperative magnetic resonance imaging. The investigators found that patients with pathologic medial meniscal extrusion had significantly worse clinical outcomes as measured with knee injury and osteoarthritis outcome scores, KOOS. Moreover, patients with higher-grade medial meniscal extrusion were more likely to have poorer clinical outcomes. Despite these findings, medial opening-wedge high tibial osteotomy had a satisfactory survival rate at a mean of 8.1 years regardless of the extent of preoperative medial meniscal extrusion. These findings highlight that medial opening-wedge high tibial osteotomy is an attractive treatment for patients with medial meniscal extrusion, and that preoperative medial meniscal extrusion is not a contraindication for the procedure. However, orthopedic surgeons should thoroughly evaluate medial meniscal extrusion prior to surgery to better estimate its outcomes.